ahead and get started. It's 8:05. We've given people a few minutes to get logged on. We're really excited about spending this next hour together, and we have a ton of information to go over, so I will make my introduction and welcome brief, but I just want to really appreciate those that are participating today. We have Dr. Jalot, who's our pharmacist from Touro University, who's going to give a really comprehensive overview of the vaccine process, and it's going to be really educational, so very excited to have him and his expertise with us. Dr. Schinder is also going to share some great news, which is that our vaccine supply is coming, and we are getting ready to start talking about rolling it out. So this presentation is very timely, and there's going to be more information about what that means for all of us as employees at OLE Health in terms of receiving the vaccine. And then we have Dr. Chris and Dr. Tran, who both have graciously volunteered to share their personal experience as two individuals who have already received the vaccine. So we have plenty to share. Please enjoy, and we'll try to leave some question time at the end. So thank you so much, and for now I will turn it over to Dr. Schinder.
Thank you, Alicia, for that introduction. Good morning, OLE Health. Thank you for joining us today. I hope you are all enjoying your morning cup of tea or morning cup of coffee. Today I'm going to talk about several items before I hand it over. I'm going to talk about the workplace outbreak, AB 685, masking, washing hands, employee testing, vaccines, and then I will hand it over to Dr. Mohammed Jalot, our pharmacist from Touro. After that, we're going to hear from Dr. Chris and Dr. Tran, who both received the vaccine. It's been a year now that we have been fighting COVID. The first United States case was identified on January the 20th, 2020. It seems like yesterday and like a lifetime ago. So I'm just going to let that sit in for just a second. I also want to point out that I'm going to continue to wear my mask as I speak. I also acknowledge that I used to take my mask off when I would speak to you guys. Over the year, we have learned a lot about COVID, and we're learning that it might spread further than 6 feet when it's in an enclosed area. So for everyone's safety, because there's other people in the room, I'm going to be keeping my mask on. With the workplace outbreak, so like we had talked about last time, a workplace outbreak is anytime there's 3 COVID positives within a 14-day time frame. At one of our health centers in the last 14 days, there have been 3 positives, so there's been a workplace outbreak. Anyone who was involved has been notified. There's no surveillance testing follow-up that's required, as it was a limited case. AB 685. A new law went into effect this year called AB 685, which requires us to notify all employees who work at a site when there is a positive. Some of you have already received an email letter this week. If you are emailed a letter, that means that your exposure was low. If your exposure was high, that means you were less than 6 feet, unmasked, for more than a cumulative amount of 15 minutes, you will be notified verbally and then told the next steps. Usually the next steps are quarantine. So you guys will be seeing these letters a little bit more frequently. So for example, if there is a positive at our St. Helena site, everyone who works in St. Helena is going to get the notification. Masking. Friendly reminder just to wear your mask 100% of the time unless you are alone. For eating, please remember to maintain your distance. If you remove your mask to eat, please put it back on as soon as you are done eating. Washing hands, it's a really good habit. Remember, wash your hands anytime before you touch something and anytime after you touch something. You have to assume that everything is dirty. Even though we're doing our best to keep everything clean, you have to assume that other people are touching stuff. Employee testing. Thus far, we have collected 83 COVID tests. That is a lot of noses. Our next collection will be at S&C on Monday, January the 11th, from 7:30 to 8:30. After that, we will tentatively do it every other week, rotating between South Napa Campus, Pear Tree Lane, and Fairfield. For example, we will collect on January the 25th from Pear Tree Lane and February the 8th from Fairfield. Thank you to facilities, Jackie Espinoza, Tanya Coronado, and Cindy Perez for making this happen. Vaccines. This is the exciting part. Vaccines are coming this week. Yay, we are part of history. This is so emotional and so exciting. OLE Health will be receiving 200 Moderna vaccines this week, and we will distribute them over the next few weeks. They will be given at S&C due to spacing and access to sinks. I have carefully gone through the OLE Health roster and contractor roster to determine the distribution order. It is based on use of an N95 mask, in-person patient care and contact, ability to return to in-person if vaccinated, and so on. I believe that we will be able to vaccinate all employees seeking a vaccination. North Bay has graciously offered to vaccinate our Fairfield staff with the Pfizer vaccine. Vaccination will start next week for Fairfield office. If you work in Fairfield and you have not yet received an email from either Dora, Miguel, or me, please let us know ASAP so that we can ensure that you are on the roster to get vaccinated. I have been asked multiple times if the vaccine is mandatory. It is strongly, strongly encouraged, but it is not mandatory. If you are hesitant to receive it, please reach out to your supervisor, anyone on clinical leadership team, Dr. Mohammed Jalloh, or myself, and we will be happy to talk through it with you. Some of you might have heard or seen on SharePoint that colleagues have already received the vaccine. They have. 47 OLE Health staff have already received it. Some people work at Queen of the Valley, St. Helena, and Kaiser and have received them from there. Others were vaccinated generously by St. Helena Hospital in December in an effort not to waste any vaccine. St. Helena went through all of their staff and started to reach out to the community to get everyone vaccinated. So once they did that, there were people that were working tirelessly through the night, early in the morning to make sure that they got arms to vaccinate them. It was a moving target. We didn't know how many vaccines they'd be able to give. Lastly, people have been asking about masking after the vaccination. Yes, we will still need to continue to mask and keep our distance until public health has cleared us not to do so. Now, I'm going to hand it over to Dr. Mohammed Jalloh, and if you don't know him, he is our pharmacist from Toro. Thank you so much for helping us to understand this vaccine better.
Oh, no problem. So what I'm going to do is I'm going to share my screen with everybody. And what I did is I tried to make like a COVID-19 vaccine 101. So I wanted to provide like an overview about like how vaccines work and then clarify information about the COVID-19 vaccine. So again, my name is Dr. Mohammed Jalloh. I'm board certified in general medicine and pharmacy. I'm a professor at Toro University, and I've been here since 2016, and I also teach at Stanford University. So to be objective, here are my conflicts of interest. So the way I'm going to go about this presentation is I'm going to do almost like a Q&A format where questions that a lot of patients have asked me, I've kind of accumulated and I made it into a presentation where I provided the question and then answer the question. So a common question that people have asked, I would say, is like, why should I even care about getting a vaccine? So I answer that by vaccines are one of the best medical marvels we've seen. And one thing they do is they prevent diseases from spreading. And one way they do it is by this diagram here, where if you see people who are blue, who are not immunized and healthy, it only takes a few people to go in. And if people are not immunized, then it's so easy for a disease to spread, as we've seen with the pandemic. However, when you have people who are immunized, that stops the disease from spreading all over the world or all over a community. So I'm going to give you guys an example of like how effective this has been because of vaccines. So can anyone tell me in the chat box any patients they've had who've come in and they reported having a disease such as polio? Or can anyone tell me any patients who came into the clinic saying, oh, they're reporting symptoms of tetanus or rubella? Probably not. And the reason why is because these diseases have been eliminated because of vaccines. However, before vaccines, unfortunately before vaccines, these diseases used to take, unfortunately, populations away, unfortunately. However, it's very uncommon for people to report these diseases because of immunizations. So one way I try to explain it too about like, well, why should I care about, immunizations is somewhat similar to like stop signs and traffic lights. The stop signs and traffic lights are for the sake of helping us prevent issues in the community. And one thing they do is they prevent you from driving too fast and unfortunately affecting other people. They're not really based for our convenience, they're really based upon keeping the community safe. And I think that's like a good way to provide as an analogy for flu shots or other immunizations, that they are there to help protect you and your community. And as a group, when we do this, this protects our entire community. So leading into the next question people ask or say, okay, well, that's okay, why we need vaccines. It makes sense. Okay. Well, how do they work in our body? So what I would say, I think Sanofi Pasteur and Pfizer, they did a good overview. So the way vaccines really work in our body is we get an inactive or weakened form of a virus or part of a virus that gets introduced to our body. And then when it gets introduced to our body learns how to recognize this virus or recognize this bacteria, and then produces things called antibodies. And what antibodies do is as soon as the virus comes back into our body again, our body knows how to recognize the virus or recognize the bacteria and automatically destroy it and eliminate it. So one way to go about that is for, let's say for the flu, what would happen is if you have antibodies, as soon as the flu enters your body, right away, our antibodies attack the flu, and then it doesn't allow the flu to get into our lungs or get into other body parts where it can cause damage. So that's really how they work. So I wanted to give like a cool, innovative way to understand it. So if you see here on our left side, we have our white blood cells in our body. And then if you look on the viruses, we have virus 1, 2, and 3. What happens is when we get a vaccine, we will get something as a vaccine, and it will teach our body to recognize that anybody who has a red helmet is a virus, and that it will automatically eliminate it. So let's say if we do get the vaccine that teaches us to recognize the red helmet, which of the vaccines or which of the viruses will we be protected against? Virus 1, 2, or 3, or multiple? Kind of a Q&A to just make sure that these things are clear. So which ones would our body be have a defense to? Yep, correct. Good job. Yep, 1 and 3, exactly. Good job. So exactly. So because our body is taught to recognize the red football helmet, when we see these viruses that are fully red or etc., our body knows how to recognize it. So that's why it makes sense. We can recognize 1 and 3 versus virus 2. It's something has a blue helmet, our body won't recognize it. So what we usually do is we get multiple vaccines so that we're able to provide coverage for all the different types of viruses. So that's like an example. So to kind of give an example of like how this goes about, here are like some different types of vaccines. So we have a vaccine, let's say we have the inactive form, where it was comparable to that football player, but instead of having a real person or a real virus, it just had a skeleton of one. An example of that is a flu shot. Then we also have other viruses or vaccines called the live attenuated virus type of vaccine, in which we give a very weak form of the virus. So an example of that, with my example, would be like a weak football player. And examples of that is a MMR vaccine. And then we have other ones where we have the subunit, where that is like we just give a part of the vaccine to trick our bodies to recognize it. So anyone who comes in and they have that football helmet on, automatically our body destroys it. An example of that is a hepatitis B. And then we have the final one. We have the mRNA vaccine, in which we don't give like a football helmet, or we don't give any part. We teach our body to create it itself to be able to defend against viruses. And examples of that are like the SARS and MERS. So then a question that leads up to that is, well, what's in the COVID-19 vaccine specifically? We have all these different vaccine types. Well, we have the mRNA or genetic code vaccines with the Pfizer and Moderna vaccines. And then for the AstraZeneca and the other vaccines, we have a DNA virus or vaccine that's inside a viral vector. And what we did is we took like an inactivated cold virus. We took out all the DNA, we took out all the dangerous parts, and then we included the instructions to make the vaccine inside of it, and then we inject that into people. So to kind of maybe understand a little better, the goal is we want to create something that our body will recognize so that our body can build a defense system to it. So for the mRNA vaccines, what happens is we just give someone an mRNA vaccine. So it teaches our body to create its own protein. So when our body sees that protein, it creates antibodies against it. Versus the viral vector one, we have a virus, a hollow shell in a sense that has that. Oh, I got a couple of chats. Oh, it says sound is cutting out. So to put this in better example, with how these vaccines work is we don't get, like I showed you guys before, like the football helmets. The vaccine for us is the instructions to create our own football helmet itself. And or our own subunit of the virus itself. So that's how these vaccines work. So they're not giving us any subunit or any helmet in a sense. They're giving us the instructions to create it our own self so that our body learns how to make antibodies to it. So then a question people ask me saying, oh, well, because the new vaccine uses DNA or RNA, does that mean it will alter my own DNA? That's a common question people ask. And my answer is no, it does not. It does not alter your DNA. It's not going to affect your DNA in any way. Reason why is that the mRNA vaccines, they cannot affect our own DNA. They don't even interact with our DNA. And the only way they could really do that is if they would enter the main office of our cells, or also known as nucleus, in which that's where they can maybe affect it. But the mRNA can't even get there because let's say our body has too many security guards to make it hard for the mRNA to get into our cell. So one thing, what happens is after the mRNA produces the protein to create the antibodies, our body just gets rid of it as trash. So to clarify, it will not affect your DNA. So then the next part is, hey, does that mean, okay, we see how the vaccines work, we see why we need it. Does that mean that COVID-19 vaccines are safe? So that's a question that comes up a lot. And then I'm going to give you the answer, yes, they are safe to take. So what would tell me that these vaccines would not be safe is if they met these three criteria. So for example, if the vaccine was not FDA approved, meaning it didn't go through any studies to validate it's safe and effective, I would agree with you and say, no, it's not safe. Two, if it had side effects that we don't see with vaccines, then I would say, yes, it would not be safe. Or three, if it had any unsafe inactive ingredients in them, which none of them do, but if they did, that's when I would say it would not be safe. So I talk about FDA approval because this is probably the most important step. So when a drug or a vaccine goes through FDA approval, they go through multiple studies to validate that they're safe and validate that they're effective. Now, surprisingly, there's thousands of drugs that go through this process, but barely, not even maybe 20% of them actually get FDA approved because during certain studies, they found out they're not safe. Some of them, they found out they don't work. And because of that, they never make it and they don't get FDA approved. So that's how we can know that if a vaccine went through phase 1, 2, and 3 and validated that it is safe, it works and safe, and they validated that, even did multiple studies to confirm it, it's very clear that the vaccine is safe and effective. And if it gets approved by the FDA, we give that confidence that it is. Because, and another thing is the FDA is kind of like the gold standard around the world, where if a drug can get approved in the FDA, it can get approved all over the world because we have the strictest standards. But here's a question people ask a lot. They say, well, why did the vaccines get approved so quickly? And that's a fair question because let me be real with you guys. Usually vaccines take probably like 10 to 20 years to make, and to the point of the idea all the way to the point of actually giving it to people. Now, the sad part about it is a lot of the reasons why it takes a long time is just because there's arbitrary like laws that prevent a speedy execution of the studies, and there's just delays in clinical trials in a way. So here's like maybe some key reasons why this study or these vaccines were able to be produced so quickly and not 10 to 20 years like we take for other ones. So here's probably the biggest reason. With these vaccines, the mRNA ones, the great thing about it is it only took a few weeks to develop the sequence and actually create the vaccine. However, for other vaccines, like let's say for the regular flu shot, you actually have to develop the vaccine in chicken eggs, in which you literally have to harvest them and have them grow. And it probably takes a good 5 to 6 months before you even have vaccines that are available to even start even testing on. And that's probably one of the reasons why it was so quick. So another thing that we've seen was that the phase 2 and 3 studies to see if the drug is safe and effective, instead of doing them and then waiting a couple months to get see if everything's okay, we did them at the same time. And that was one way to, again, make it easy for us to get the study done quicker. The last thing, or the other big thing, was the data was reviewed simultaneously via like digital remote monitoring, kind of like how we do remote patient care. They were doing remote monitoring for a lot of patients. So instead of having the patients come in to get their be evaluated, a lot of times they were able to do things from their home and able to get that data simultaneously. And that was one way to make it a little bit faster for people. The other thing that I would say, again, one of the reasons why I was able to get approved so quickly is because the FDA prioritized reviewing this. So keep in mind, the FDA has hundreds, they received hundreds of applications about approving drugs. But what they did was, because this vaccine was so important, they prioritized it, saying, okay, we're not going to put this at the bottom of the pack. We're going to put this as number one. So instead of taking months to years to review the information, they reviewed it instantaneously. And probably the biggest reasons why we were able to get this drug or these vaccines completed within a year was we had collaboration. And I always say teamwork makes dream work. We were able to get teamwork between pharmaceutical companies to help produce these vaccines. And it just shows when you're able to share information and work together, you're able to do amazing things like that. So that, again, leads back to our question about like, hey, I mean, does that mean vaccines are safe? Right. So again, I'm going to keep saying, yes, they are safe. They definitely went through everything they needed to go through to the FDA, and the FDA has the most rigorous standards. The other thing that we look at is we evaluated the incidence of side effects. So one thing that I think will make us very distinctive of these vaccines is every year we get the flu vaccine. And every year there's studies that are conducted to validate that the flu vaccine works. Now, surprisingly, we only study 1,000 to maybe 2,000 people every year for the vaccine. But for the Pfizer vaccine and the Moderna vaccine, we studied over 40,000 or even over 30,000 people in each vaccine. So over 10 times more people in the flu vaccine than with these other ones. And we were able to show that these are pretty safe and they have the same side effects. So I think the side effects that you can get with the flu vaccine, you will likely could get with the Pfizer and Moderna one. Whether if you get an injection, there might be a little bit of pain, there might be a little bit of weakness, muscle pain, but they're very comparable to the annual flu vaccine that we get every year. Same thing with all the other ones. So then a question that comes up that people ask about was, well, what about all these issues about vaccines causing infertility or Bell's palsy or other side effects? So my answer to that is that vaccines have been validated, I would say, to show that they really don't cause autism. They really don't cause Bell's palsy, infertility, or polio or Guillain-Barré syndrome. And like some reasons why they are associated with the vaccine is because one, there was like certain contaminations that happened in certain formulations, and that's why that was a side effect of those contaminations. So here's like a key, I'm sorry, it looks like I have some chats. right? So then, and what I'll do is I'll answer the questions toward the end. All right. So then, here's an example of why people maybe associate certain vaccines with certain side effects. I would say number one, there was a polio vaccine mess up. If you guys heard about this disaster, around in 1955, when polio was such a big thing, there was a company who developed a vaccine for the polio. And one of the researchers noticed that, hey, when we gave a batch to a monkey just to verify everything's okay, that monkey developed polio. So surprisingly, when that person brought it up to their CEO and said, hey, this batch doesn't look good, what happened is that batch actually had the polio virus in it and not the vaccine. And of course, these companies kind of disregard it and say, oh, no, it's fine. You don't know what you're talking about. And unfortunately, those tainted batches were sent out throughout the community. Now, what happened because of that is there was all these outbreaks of polio. And people were like, oh, crap, it must be the vaccine. But then they found out that it wasn't really the vaccine. It was just a single facility that had a botched version of the polio vaccine. And when they took out that formulation, they were actually able to give the correct vaccine to millions of people. And that's why we really don't see polio as being as common today. And because of that, that's really led to a lot of strict manufacturing standards. And that's why you guys will hear all the time, like, hey, oh, if a study or if something happens with a batch of medications, automatically they'll get rid of all of them. If you guys remember when ranitidine or famotidine last year, there was issues about how we couldn't get them. And this is an example where if there's maybe an issue with the single batch, they won't hesitate to remove a drug from the population to make sure it's safe. So that's an example of like how we've improved our standards from back in the 50s. So again, that again leads to the question of, does that mean the COVID-19 vaccines are safe? So then another question I would say that people ask is, okay, after we see that the vaccines they're pretty safe. They're comparable to the flu shot in side effects. One question people ask is like, do the vaccine actually work? And again, I'm gonna tell you, yes, they actually definitely work. So one of the things that it was surprising, right, was the coronavirus vaccines were 94 to 95% effective, something we've never seen with vaccines, especially ones with a virus like this. Because and just to put it in context, the annual flu shot is only 29 to maybe 48% effective if you combine or you get a range since the past couple of years. So something that we were not expecting it to be this good. So that's one thing that we were surprised. And even when the FDA was trying to say, okay, we want to make an approval for this, they even said that we'll be okay if the vaccines are even 60% effective. So they were not expecting them to be over 90% effective. So this means they're definitely work, because our flu shots are only 29 to 48% effective. We were not expecting it to be this good. And we feel that this is going to change vaccines the way that these ones were made forever. We're going to be making vaccines comparable how we did for these ones. So I know hopefully maybe some of you feel a little bit more motivated saying, okay, we see that they're safe. We see that they work. Well, how many shots do I have to get? So for the Pfizer vaccine, you're going to get 2 doses, 1 dose, and then 3 weeks later, you're going to get the second dose. Now, for the Moderna one, that one, instead of in 3 weeks, is going to be 4 weeks in between doses. So the common question, again, people ask and say, okay, if I get the vaccine, when will I be considered to be protected? So based upon the data and based on prior studies, it's very likely that after you get the second dose of the coronavirus vaccine, probably within a week to 2 weeks, that's when you'll have this certain level of antibodies that will be considered that you are protected. So in summary, I would say COVID vaccines are considered medical miracles that have virtually eliminated diseases like polio and measles, etc. And what the vaccines do, they just take advantage and they trick our body into creating bodyguards to defend against germs and viruses to make sure that they don't cause any havoc. What I would say is that the Moderna and Pfizer vaccines are pretty much considered safe. They're very effective. I'm confident enough that I'll be happy to receive them. And likely after you receive the vaccines, you'll probably be considered protected within 7 to maybe 14 days after the second dose. So that's what I have as like a review of the Vaccine 101 and update. So I do see some questions in the chat. I think one question that I've received from OLE Health is it safe to get the vaccine if you are pregnant? And I'll tell you that the boards, I believe the ACOG, they are recommended that people who are pregnant receive the vaccine. But I will clarify, and I want to make sure this is clear. As of now, we don't have any data regarding patients who are pregnant. So that's why we don't have data with patients who are pregnant, and we don't have data for kids who are less than 16 years of age. So because of that, we do lack data. However, what the CDC and other people have recommended, saying the risk or the concerns of the coronavirus itself outweigh the risk and concerns of receiving the vaccine for children and for pregnant patients. So as of now, they're recommending them, but I'll be frank that we don't have data to validate. A question that Jimenez asked is, what's the difference in any from Moderna and Pfizer? There's really no difference per se, except one or a couple differences, or there's this difference in storage requirements, meaning the Pfizer vaccine has to be stored in a very cold temperatures, in which you have to have specific fridges that can get you down to that low level. And then two, the Pfizer and Moderna vaccine, there's just differences of how frequent you get the vaccine. So for the Moderna vaccine, you get one dose, and then in 28 days later, you get the second dose. For the Pfizer vaccine, you get one dose, and you only have to wait 3 weeks or 21 days. So those are the big differences. Okay, so a question that Jeanette asked is, where did the concern for possible infertility originate from? What I'm just based upon what patients have told me, other providers have asked, is that people have associated vaccines, unfortunately, with some of these side effects. So that's one of the reasons why I wanted to clarify, like there's no data validating that vaccines cause any issues about infertility. What about safety for breastfeeding? That was a good question I got. We have no information related to breastfeeding because there isn't data that I'm aware of regarding patients receiving the vaccine and their breastfeeding. So that one we're not sure about. And that's one concern. We do not know the safety. But I will be frank in saying that comparable to other vaccines, it's very unlikely there would be a concern. Because people, I know as a pregnant person, I believe they've received vaccines while they're pregnant, and there isn't any concern about breastfeeding. So it's very likely these vaccines, there's no issue as well. A question I got, is there any info on how the vaccine affects immunocompromised people? That's a great question. There is, in some of the studies, there was some patients who were included who were immunocompromised, but I'll be frank in saying if a patient's immunocompromised, they are at the high risk that we want to get them vaccinated, because getting the vaccine will be so much better than actually getting the virus itself, because if you're immunocompromised, your body's probably not even strong enough to fight the virus itself. That's why it'll be very important for someone who's immunocompromised to get the vaccine. And that's why they're actually considered a high priority group. A person from OLE Health, where may I find the medical studies for COVID-19? If you go to Lit COVID or to PubMed, they have a whole directory of all the COVID-19 vaccine studies. The side effects of the vaccine, good question. I think I answered it. Comparable to the flu shot. So if you get the vaccine, you'll likely feel like muscle pain, a little bit of like pain in the injection site, comparable to a flu vaccine. Okay, so what would, a question that I was asked, what would you say to patients who do not want to get the vaccine because they feel the side effects or long-term effects have not been studied long enough? My answer to that, that's a fair assessment. The challenge I have is that every vaccine that we receive now, we essentially mimicked everything we've done with other vaccines. And the surprising thing is a lot of other vaccines have not been studied as long as we thought they've been studied, and we just been emulating and replicating the formulations. So a lot of vaccines that we receive every year, we don't do long-term studies on those. A lot of those have just been based upon studies back in the 70s or even 80s. And I would say the concern would likely be about the inactive ingredients. That would be the concern about the long-term effects. However, all the inactive ingredients have been considered safe. And that's why we're not really concerned about any side effects or long-term effects. We would likely be concerned if the vaccine itself maybe didn't go through FDA approval. Then we would likely be concerned about side effects or long-term effects. But they have experts and they validated, and I've looked at it, that there's no concern. The bigger concern would be the long-term effects of actually getting the COVID-19 virus, because unfortunately we've seen that the virus actually can invade the brain and stay situated there already. So we've seen that getting the virus itself actually could be worse, and we want to minimize that issue. Oh yeah, a question people ask, is there any information how often we'll need to get the vaccine? Would it be like the flu vaccine every year? I'm not sure what the CDC is going to recommend. My professional opinion is unfortunately, because that this virus has mutated and it's trying to survive as it's already mutated, it's very likely we're going to have to be getting it every year. And kind of like how we get the flu shot every year, the reason why we get it is because the flu actually knows how to mutate because it wants to survive. It doesn't want to die. And that's why it mutates every year to avoid being killed. I suspect because we already see mutations already, it's very likely that we're probably gonna have to get this every year. But that's just my professional opinion. Oh yeah, question someone asked is, you mentioned mRNA for other vaccines now to increase efficacy. Are there other vaccines that use mRNA now? That's a good question. So yes, for the Zika virus, they use the mRNA vaccine. And if you guys heard of SARS, that was back in the early 2000s. There was SARS and then MERS, the Middle Eastern, I believe, respiratory syndrome disorder. That was caused by another coronavirus. And we actually seen that the mRNA was pretty effective for treating that. But the interesting thing that happened is during that MERS and SARS outbreak, the virus died itself. So that's why we weren't able to do further studies. But we already had a lot of that data that led up to the data being used for this vaccine. To also answer your question, there's probably going to be a lot more mRNA vaccines now because people are seeing the benefit of them. Now, pharmaceutical companies are going to pay to study this more and pay to make these vaccines. Unfortunately, the money makes the world go round. And the reason why we didn't have as much mRNA vaccines previously is because vaccines themselves don't make a lot of money for pharmaceutical companies. But now, because we see the benefit of them, it's very likely we're going to see a lot more mRNA vaccines. A question, what if you are asymptomatic and get vaccinated? Is the vaccine still going to be effective? That's a very good question. That one, I'm not sure if we don't have that information as of now. The vaccine, what it does is, again, gives our body the security guards or antibodies to protect ourselves from giving people the virus. Hopefully, what it does is it kills the virus before it can spread or replicate in our body. So I don't know if there's a direct answer. If you're asymptomatic and get vaccinated, is it still going to be effective? I would say it's going to be your better bet than not doing anything at all. All right. Oh yeah, so the question again, do lifetime protection or will it likely get the flu vaccine that you have to get yearly, like I said before? It's very likely we're gonna have to get it yearly because as you've seen, the virus is already mutated because it's trying to survive. And it's just like the flu or the every year cold, it mutates to avoid getting killed. So it's very likely we're gonna have to get this very often. But that's just my, again, professional opinion. Oh, so the question is, once fully vaccinated, will the person still be contagious? That's the question that we're trying to find out. They're doing studies right now to evaluate whether people, if they're fully vaccinated, are they still contagious? That one, we're still not sure, and that's what they're still recommending, that if you receive the vaccine, you still wear the masks to prevent you from spreading the disease to other people. A question, can you still get the vaccine if you have flu-like symptoms or COVID? Yes, it's still recommended. What people do, what it's been studied is that if you had the coronavirus, if you already got sick with COVID-19, you likely already have the antibodies for at least 3 months or 90 days. However, it's still better than nothing because it's possible that it could be further extended, that protection could be further extended by getting the vaccine. Now, whether there's an exact timeline, that one we're not sure, but I suspect it'll be better than not getting it at all. Let's see. Will this presentation be available for our OLE website for our patients community? That one I will leave up to the people here. Okay, so I think I answered majority's, everyone's questions. Any other pressing ones?
Thank you. Hi, everyone. This is Dr. Shinder. Thank you so much, Dr. Jalot, for doing this. I know everyone has a ton of questions. I just want to make sure that we get an opportunity to hear from Dr. Crisp and Dr. Tran. Dr. Jalot, if you're able to stay on in case we finish a little early and people have other questions. Also, like Mario had typed in the chat, if you have any questions, please feel free to reach out to Dr. Jalot, the clinical leadership team, and myself, and we'll get all your questions answered as well. So now I'm going to hand it over to Dr. Allison Crisp, and she is our medical director of pediatrics, and she's going to tell us about her experience. Thank you, Dr. Crisp, for being here today and sharing with us.
Sure. Well, I'm glad I can be here and share my experience. There's a lot of new faces at OLE. My name is Allison Crisp. I'm one of the pediatricians, and I'm the medical director for pediatrics. And I was fortunate enough to get the Pfizer vaccine from the Queen. Myself and Dr. Wyborny and Dr. Jen all see the newborn babies at the Queen, and so we were able to get the vaccine there. We're seeing a lot of mommies who are pregnant coming in positive for COVID, so it was important to protect ourselves and protect other people. So from just a experiential standpoint, I felt like the vaccine, it felt like the flu shot, honestly. Like I had a little bit of soreness for a day or so. This year, interestingly, normally the flu shot I'm totally fine with, and this year I felt a little crappy after the flu shot, and so I felt a little bit similar with the Pfizer vaccine. I just kind of felt a little bit of a headache the next day, but nothing that really impaired my ability to do anything. And I think maybe because I knew I got the vaccine, I was a little bit more aware, like I was heightened and looking for symptoms. So would I have noticed it otherwise? Probably not. But because I was thinking about it and really trying to pay attention, I was more aware of perhaps maybe I had a headache, but definitely a little bit of arm soreness, but that went away. I didn't take any Tylenol or ibuprofen. I was totally fine. And so, you know, my job as a pediatrician, I'm well versed in talking about vaccines. It's part of my daily life. And so I thought it was really important to become educated on this particular vaccine and the risks and benefits. And so I think Dr. Jalot made a really good presentation to really drive home the point of, you know, assessing the risk versus the benefit. What is the risk of COVID versus the benefit of not getting COVID, not being a risk to your family or to others, and the risk of the vaccine in and of itself, which is low. And then the other perspective that I wanted to share with you all is, as most of you know, I had a little baby. He's about 5.5 months now, and I'm breastfeeding him. And so somebody asked the question, is it safe to breastfeed with this vaccine? And I can tell you that, you know, a lot of people have asked me that, like, are you going to get the vaccine because you're breastfeeding? What do you think? So again, I did my due diligence, and I really looked at all the information. if anybody who is breastfeeding or is pregnant, the American College of Gynecology and Obstetrics has a really good policy statement out, as well as the American Breastfeeding Society. And I think the perspective is, what do we do normally if we're breastfeeding or pregnant? Normally we give a Tdap if you're pregnant. Normally we give a flu shot if you're pregnant, and those are all super safe. And we want to do that because we're actually protecting the baby, right? We're protecting mom, and we're giving good antibodies to the baby. Same thing for breastfeeding. I felt like, one, you're getting an injection into your muscle, so you're not getting an injection into your bloodstream. It's not going into your blood. And so therefore, it's not going into the milk at all, so he's not getting any of the actual vaccine in the breast milk. What he's getting are the antibodies that my body is making to coronavirus, and that, to me, is the best protection that I can give him. And so I thought that that was really important to be able to protect him, because he can't protect himself from coronavirus, and it could be really dangerous for him. And then if I'm sick because I have COVID, I can't take care of him as well as I could. So I wanted to share that perspective, that that was a decision I made, knowing there are studies that are ongoing right now for specifically breastfeeding and pregnant women, but also being aware of what we do for women already in those circumstances. Another example is the chickenpox vaccine, which is a live vaccine. There's actual virus in that vaccine. If mom has chickenpox or concerns about chickenpox, we actually give her the vaccine that is live, even though she may be pregnant or breastfeeding. So, so those are examples that I use to help make my decision to continue to breastfeed and give the vaccine. And I got the vaccine on a Tuesday evening, and I went home and put him down to bed nursing, and he did fine. So we are all okay, and I feel like we're all safer at the end of the day because of it. And if you guys have any questions or concerns, certainly I posted on social media that I got the vaccine, and a lot of my physician colleagues who were either pregnant or breastfeeding reached out to me over social media because they had concerns and questions. So if any of you guys have concerns or questions, I'm happy to answer them, and feel free to reach out to me.
Great. Thank you so much, Dr. Chris, for that information, and I really appreciate you being comfortable to share all that personal information with us. Next, I would like to hear from Dr. Linda Tran. She is a dentist who also received her vaccine.
Hi, good morning, everyone. Can everyone hear me okay? I just want to make sure.
Yes.
Okay, perfect. Okay, so I'm Dr. Tran. I'm one of the dentists here at South Napa campus. I'm happy to share my experience because like to, try to, I know a lot of people are curious what the experience is like, so I want to be able to share that so people can know that that it's safe. So my personal experience, I did end up getting the Pfizer vaccine bright and early on a Wednesday morning at 7:30 at St. Helena Hospital. When I had the opportunity, or when I was given the opportunity to sign up for it, I kind of jumped at it right away and was really excited to do so. The experience itself, I barely felt anything when I got the actual vaccine. And then my arm was just sore for about a day or two. Other than that, I didn't really have any other side effects. I personally do have a lot of food allergies. So initially, early on, I was wondering, there was like out in the news whether it'd be safe for people with allergies, but I still kind of weighed the benefits and the risks with the vaccine and with the virus, and I decided that I still wanted to get it. And so despite that, I didn't have any or any allergic reactions at all. Let's see, why did I want to get it? I'm sure, we've been going through this pandemic for a long time now. I'm sure everyone's really tired for things to go back to normal, to get together with family and friends, go to restaurants, to travel. And so I just feel like this is one step towards things going back to normal. And it's a way to protect myself, but also protect others in the community, and wanted to take that step. And what it meant for me was that, it's kind of a historical moment in, receiving a vaccine like this. So I didn't really have much doubt in my mind when the opportunity was given to me to receive the vaccine. It also kind of, solidified my feelings about getting it when I saw so many other healthcare friends on social media post that they were receiving the vaccine, from nurses to surgeons to physicians, PAs, and pharmacists, including those that were nursing as well. A lot of them did their due diligence, and I myself as well. And so after that research and asking people about their experience, I felt comfortable getting it myself. That's pretty much, and what do I look forward to after all this is over? Seeing my parents again. I haven't seen them in over a year. I'm about to have a nephew born in a couple weeks. I look forward to meeting my nephew, playing with my nephew, knowing that I'm protected and I'm not, protecting them as well. So yeah, that's pretty much my story. And after everything, I think the benefits do really outweigh the risks when you're looking at the vaccine versus the possibility of getting it. Okay. Yeah. So that's my story.
Thank you so much, Dr. Tran, for sharing that personal story with us as well, and sharing the food allergy and in such a public setting. So I appreciate that. We have 4 minutes left. Are there any final questions that people have? We can field them for the next few minutes.
Okay, so I was just we're getting a couple more questions coming in as we're wrapping up. And the question about the 200 vaccines being delivered, I just want to reinforce what Dr. Schinder's already shared, that we have enough vaccinations to cover any of our employees, anyone at OLE Health who is interested in receiving the vaccine. And that does guarantee both the first and the second dose. So if you start the process, you're guaranteed to get that second dose as well. In terms of the plan of how it will be rolled out, that is something that's going to be developed. It's already underway. Dr. Schinder, I don't know if you want to say more about how it will be rolled out in more specifics, or just update next week as we're starting the process.
Yeah, I'd rather wait to update until we have the process, because I don't want to have to back up. So we want to make it as smooth and easy as possible for people. As Dr. Schinder shared, even though we're receiving the vaccines this week, we will be being very thoughtful and planful about how we're distributing it over the next 2 weeks, so as not to rush the process, and ensure that we are being very communicative and safe, and that we have the requirements in place to make sure that we're observing people, distancing folks, and that everyone is able to come in and get the vaccine with minimal disruption. And so I do know that we are wrapping up our time. I really hope that this felt informative and helpful. Our only goal was to provide you with more education and more information to make a decision. This really is a historical moment. It's so exciting that we have the vaccines, and I'm so grateful that we don't have to make any decisions about who gets it first. It is completely open to every single person in our organization, in our OLE family. And so we're very fortunate to have that. Not all community health centers and not all organizations are in that same position. So as we wrap, a special thank you to everyone who shared today. Dr. Tran and Dr. Chris, thank you for sharing your experiences. And Dr. Schinder, of course, for your continued leadership throughout this pandemic. Dr. Jalot, we're so lucky to have a resource like you. And so thank you for sharing your expertise and your time
I learned a ton, and that was really helpful the way you broke everything down so simply. So if additional questions pop up, please reach out to Dr. Schinder or Dr. Gillot, and I'm sure they will be happy to follow up with you. We'll make all of this information available both internally as well as publicly if you'd like to share it with family and friends. We're all ambassadors to help spread the word, spread information. We'll get these same questions that you have from our patients and from your family members, so we really want you to have as much information as possible. So with that, we'll wrap up and have a wonderful Thursday, and we will see you later again this month.